January is observed as Cervical Cancer Awareness Month, dedicated to enlightening the public, especially women, about the disease. Cervical cancer is the most common cancer among women in 36 low and middle-income countries, mainly in sub-Saharan Africa. This is our focus today on Sound Health. I am Olasumbo Modupe. Happy New Year to you. The program continues after COVID-19 updates.
The National Primary Healthcare Development Agency has urged state governments to step up mass vaccination against COVID-19 as part of moves to combat the virus. The agency in its latest advisory also urged state governors to enact and enforce vaccination mandate for local and state government workers. This came to fall as a percentage for fully vaccinated Nigerians stood at 4.2%, while those that had taken the first dose remained grounded at 9.8% as of Sunday, January 9, 2021. The NCDC in its daily updates continued to report an increase in the number of fatalities, reporting no fewer than 38 deaths between January 1 and January 8. Despite the increasing number of cases and deaths, some states have not vaccinated up to 200,000 individuals, while Abia, Kogi and Niger states have not commenced administration of booster shots. While some states had commenced the booster administration, analysis revealed that Akwa Ibom, Anambra, Benue, Ebonyi, Imo, Kwara, Sokoto and Yobe had yet to administer boosters up to 100 residents.
Guest today is Dr. Uzomaka Igwilo, Communications Manager, George Carey Life Foundation. Thanks for agreeing to share your expertise on cervical cancer, Dr. Igwilo.
Pleasure is all mine.
All right, cervical cancer is the most common cancer among women in 36 low and middle income countries, mainly in sub-Saharan Africa. Can you please share with our viewers what causes cervical cancer?
Cervical cancer, just like the name implies, is that cancer that affects the cervix, which is the entrance to life. The cervix serves as the neck of the womb. You know, when a woman is in labor, the doctors and the nurses, they keep doing checks at interval to check how open the cervix is before delivery. So cervical cancer is that part of the womb that is affected by an infection known as the human papillomavirus infection. So what this human papillomavirus infection does is that when in the cells of the cervix, it leads to cancerous cells. Now, these changes can take as long as 5 years, 10 years, 15 years, depending on various other factors. Indicated, depending on the age of the woman and the type particular changes starts occurring. The woman is unaware that there is anything going on in there until it begins to manifest signs and symptoms. And at the time these signs and symptoms manifest, it's almost too late, to do any intervention that will result in a complete cure. The reason why we're pushing for this is because of all the human cancers, cervical cancer is actually that one cancer that can be prevented 100%. And prevention can only be achieved when women are aware of the problem and begin to do yearly screening. And so because the signs and symptoms are things that may not resonate as cancer, again, before women present, is usually too late. Some of those common signs and symptoms include things like foul smelling vaginal discharge, intermittent bleeding, that is bleeding in between menstrual period, or for a woman who has already entered her menopause, she suddenly notices she's having intercourse, when the woman goes to clean up, she realizes, oh, she's having one or two blood spots. Again, these symptoms and signs are not exclusively for cervical cancer, but those are some of the common symptoms a woman could present with. Other things include generalized weight loss, weakness, fatigue, and as a result of the blood loss, the woman begins to feel anemic. Now, approximately women above 15 years and above, 40 million women are affected by this cancer yearly. 63% of all genital cancers is as a result of an infection caused by the human papilloma virus infection. Now, yearly, about 15,000 women are diagnosed as having cervical cancer. And of those diagnosed, because of the late presentation, approximately 10,000 of those women diagnosed will die from cervical cancer. And this is something that is heartbreaking, considering the fact that if these women did screening earlier on during the period of the change and the changes were picked up, they could have benefited from a treatment, an outpatient treatment that could have taken care of the problem, preventing the changes from progressing to cervical cancer. But one of the major challenges we're having, and which is what George Carey Life Foundation has been trying to do by creating several programs, creating several awareness programs, because at present, only about 15% of women aged 20 to 65 years in the Southwest region are aware that there is a disease known as cervical cancer. So if you're not even aware that such a disease exists, how then will you take the initiative to get the screening? So George Carey Life Foundation is one of those foundations out there that has consistently, been trying to help women alleviate poverty, get women to become aware of this deadly disease, providing free screening services, partnering with Lagos State Ministry of Health across the healthcare system, to provide free screening services and treatment. So there's a see and treat approach, which makes it easier and makes it a one-stop visit. Once the women visit these centers and they are screened and any of those changes is picked up, they can
All right.
get a treatment known as cryotherapy treatment.
All right, Dr. Igwilo, are you with me?
Yes, I'm listening.
All right, now, before we go into the treatment and all that, let us look at, you mentioned in your response that cervical cancer is also caused by human papilloma virus. What exactly is human papilloma virus, also called the HPV, and how aware are people about cervical cancer? Many people still feel it is a spiritual attack. I would like you to emphasize on the HPV now.
The human papilloma virus is one of those viruses that is transmitted through sexual contact. Now, without sexual penetration, the human papilloma virus can still be transmitted from skin to skin contact. So close, intimate skin to skin contact can also transmit the human papilloma virus. Specifically, the type 16 and type 18 have majorly been implicated in the cause of cervical cancer. So when the infection occurs, the woman is not aware that there is an infection. And because it's a viral infection, it goes into the cells of the cervix and starts causing slow, gradual changes and transformation of the cells of the cervix around the transformation zone. And these changes, they don't have any signs, they don't have any symptoms. So women are not aware. At present, over 630 million people who are sexually active have already contacted the virus. Now again, nature in a way tries to create some form of balance because the body tries to fight off some of those infections. So of 100% of women who get the human papilloma virus infection, approximately 90-80% of the women who have good immune status, who are in good positive health status, who do not smoke, who do not drink alcohol, some other factors that may encourage the growth of the human papilloma virus. So 80 to 90% of these women may be able to fight off the infection naturally. But science has shown that in about 10% of the women, this human papilloma virus infection persists and it progresses to cause cancer in future. And these changes may take breast cancer. And human papillomavirus also causes other genital infections, like the genital warts, other cancers occurring in the genital area. But the focus today is on cervical cancer, which affects women.
Unfortunately, most women do not know about this disease until it's at the terminal point. Now, is there actually hope after the diagnosis, and how do you beat cervical cancer?
Yes, thank you for raising that again. Now, because it occurs at a part of the body that is not obvious, when those changes are taking place high up in the vagina, where the cervix is located, women are usually not aware. They do not know anything is going on until the late stage, when it starts showing signs and symptoms, which includes things like pain during sexual intercourse, spotting during sexual intercourse, intermenstrual bleeding, or postcoital bleeding, or bleeding postmenopausally. That is, a woman who has already observed her menopause suddenly starts seeing blood again, thinking it's a resumption of the period without realizing it's a danger sign. Foul smelling vaginal discharge, weight loss, and all that. It's a broad spectrum of signs and symptoms. The major challenge with cervical cancer in this part of the world is that the level of awareness is very low. Less than 15% of women aged 20 to 65 years, which is the major age group that comes down with this illness, they are not aware. And again, we are very religious in this part of the world. We believe in so many other things. That compounds the issue, because even at the time a woman starts noticing some of those things, you begin to hear things like, oh, it's a spiritual attack, oh, it's my enemies, oh, this and that. And so presentation to health facilities occurs very late. Very, very late, at the point where there is really nothing anyone can do again to save the woman's life. And you know that majorly is the women that, they say build a woman, build a nation. So, and it's occurring at a time in the lifespan of the women where the family needs them the most. So we're preaching and we're advocating. People need to be aware of this illness because it is preventable. If a woman goes for screening, there are various methods for doing cervical screening, So it's important that every woman who is sexually active goes for cervical screening, depending on what type of screening. Screening ranges from between 1 year to 3 years interval. Okay. And so what cervical screening does is that it picks up those early changes, at which point treatment can be applied, and it takes care of the infection and transformation of the changes caused by the human papillomavirus infection. And it's a one-stop approach. Once a woman gets to the facility and she's screened, and this is called the see and treat approach, and those changes are identified, the woman will be counseled, educated, all her choices will be made known to her, and then she can decide on the spot there, right there and then, to do a treatment known as the cryotherapy treatment, which takes care of it's application of cold treatment, which burns off those cells that are transforming already. So it takes care of that infection and prevents it from completing the change to become cancerous. And this treatment is a one-off outpatient treatment. So the woman doesn't necessarily need to come back to the health facility again and again or be on admission. And so that's why George Carey Life Foundation has pushed in so much effort, trying to create awareness, partnering with Lagos State Ministry of Health across Lagos State to create screening centers within the primary health care facilities so that it is accessible to women. And at these facilities, women have the opportunity to learn so much about the female reproductive organ in general. They are educated, awareness is created, they decide if they want to do the screening immediately and all that. So it's a wonderful opportunity that that needs to be pushed further out there. We need to create more awareness because women do not need to die from a disease that is 100% preventable through screening and treatment. Thank you.
All right, Dr. Iguilo, we all know that routine checkup is actually a big deal in this part of the world now. How accessible or how available are screening centers? Are there walk-in centers where women can just go in to screen and treat this disease?
Yes. In fact, there's a long list of almost within every local government area. The facilities are already are available and open during normal working hours. Women can walk in freely and access the screening, and it's absolutely free.
It used to be the most commonest form of cancer, but thanks to immunization against the disease, how accessible are these vaccines? Are they really affordable? Because the World Health Organization says it is much more common in low and middle income countries. How affordable are these vaccines?
Okay, so there are vaccines available as well to help women build immune responses and resistance against human papillomavirus. But what we don't want to do is to put the cart before the horse. So you get screened first. If you're negative, then you can go ahead to decide to get vaccinated. And then vaccination still doesn't prevent you from doing occasional screenings. And these vaccines, at present, they are not easily available in terms of the cost implication. And it requires about 3 shots. There are 2 different types of vaccines. There's the Cervical vaccine and the Gardasil vaccine. So the Cervical vaccine has 2 types of preventive mode against HPV type 16 and type 18. Whereas the Gardasil prevents further. It prevents against 4 different types of the human papillomavirus, including those that cause genital warts. And as it is right now, a shot of the vaccine can range between 10 to 15,000. But again, like I said earlier, we do not want to put the cart before the horse. So we always advise, let's create awareness about this infection first of all. Let's get women screened. Let's get women tested. Let's get women checked. And then those who require treatment then goes ahead to get treatment before getting vaccinated. So we partner with some organizations who are willing to fund the vaccines, and we provide these vaccines freely to women. But again, the screen and treat approach, is the first step one needs to take before moving further into vaccination.
Thank you so much, Dr. Ozoamaka Iguilo, for your time. We really appreciate you. Thank you so much for enlightening us.
You're most welcome. Let's put the word out there. Let women become aware of this. Let women take charge. Men can also encourage their wives, their sisters, their siblings, their colleagues. All it takes is just you saying, oh, have you heard about cervical cancer? Have you screened for cervical cancer? It's a preventive method. No woman, absolutely no woman, needs to suffer from something that is preventable. Thank you.
All right, Dr. Ozoamaka Iguilo, Communications Manager, George Kerry Life Foundation. We appreciate your expertise and time on Sound Health. Hopefully, more people would be aware of cervical cancer and take action against the disease. Up next is Trending Health Reports. is where we say thank you on today's program. Hope you have been enlightened. Always endeavor to seek medical help early enough to beat diseases and stay safe always. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at LTV Social, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.